The next talk will be by Dr. Nicole Eater, and the topic is going to be microcirculation in systemic diseases. What can we learn from OCT angiography?
Dear chairs, ladies and gentlemen, these are my financial disclosures, none of them related to this talk. Several techniques have been developed for blood flow imaging and analysis of microcirculation. Optical coherence tomography is a new method that detects movement of fluid within vasculature. It's fast, repeatable, non-invasive, and its potentials are not only visualization of blood flow, but also quantification of retinal microcirculation. OCTA allows for reproducible quantification of macular and peripapillar flow. We showed these in 3 different devices. However, you cannot change the device in the follow-up of a single patient. Factors influencing OCTA measurement are age, blood pressure, heart rate, and intraocular pressure, among others. So, how can OCTA be useful in systemic diseases? Now let's start with cardiovascular diseases. In an experimental model of hemorrhagic shock in sheep, we found that there was a decreased flow density in shock and an increase in flow density again after resuscitation. Besides OCTA, we also did IDF, which is the incident dark field illumination microscopy, which is the gold standard for the analysis of microcirculation. And we could demonstrate that flow density measured on OCTA correlated significantly with IDF index in the sheep. So let's look at carotid artery stenosis. And we found that patients with carotid artery stenosis had a much lower flow density compared to healthy controls. Once these patients had a carotid endarterectomy, flow density increased again. Patients with arterial fibrillation, either paroxysmal or permanent, showed a lower flow density compared to healthy controls. Patients with permanent AFib showed a lower flow density than patients with a paroxysmal AFib. But patients with a paroxysmal AFib, even if they were in sinus rhythm, had a lower flow density than healthy controls. And, once pulmonary vein isolation, which is the treatment for atrial fibrillation, was performed, the flow density increased again. Now let's look at some neurological diseases. Flow density has been described to be lower in Parkinson's disease and in multiple sclerosis. And in this study by Murphy and co-workers, the reduced vessel density correlated significantly with reduced visual function, longer disease duration, and higher levels of global disability. And therefore, OCTA may be a good tool for the early detection and also for the follow-up in MS patients. There's increasing evidence that there is a vascular component to Alzheimer's dementia. So far, this vascular component can only be detected by MRI imaging, where the white matter hyperintensities are thought to be the small vessel defect. And so, therefore, this is the index for the vascular component. Now, we found that in Alzheimer's disease patients, the flow density measured on OCTA highly correlated with the Fazekas scale, which is the scale for the white matter hyperintensities. So there was a highly correlation. However, there was no correlation to amyloid beta and the tau protein, which are the biomarkers for Alzheimer's disease, or the minimal mental state exam. So again, OCTA hints to the fact that there is a vascular component in Alzheimer's disease. And O'Brien and co-workers showed that even in patients with preclinical Alzheimer, there are changes in the vasculature seen on OCTA. So let's look at other systemic diseases, for example, diabetes mellitus. We all know that OCTA can show diabetic retinopathy and maculopathy. However, also in patients with no signs of diabetic retinopathy, there are already changes in the vasculature seen on OCTA. There is a reduced flow density in patients with systemic lupus, and this is independent of their intake of hydroxychloroquine. There's also a reduced flow in diseases like systemic sclerosis, Fabry disease, Behçet's disease, and in the end, I would like to draw your attention to the Klinefelter syndrome, where we found that patients with Klinefelter syndrome had a smaller foveolar vascular zone compared to healthy women and men, and this was true for the superficial and also for the deep layer. So in conclusion, OCTA is an evolving technique in the visualization of retinal vessels without dye, but it is also important in the quantification of retinal blood flow. Retinal microcirculation is dependent on systemic microcirculation and is altered in a variety of systemic disorders. Thus, OCTA may be extremely useful to detect systemic diseases at a preclinical stage and to monitor treatment success. I want to acknowledge my team back in Germany, especially Majid Al-Nawaiser, who did the majority of these studies. Thank you for your attention.